Hi Riley, how are you?
I'm good. How are you?
I'm good. My name's Ashley. I'm going to be doing your full body head to toe physical assessment today.
Okay.
Can you start off by stating your name and date of birth for me?
Riley Yoho, 21095.
Okay. And what are you here for today?
I'm just here for my yearly checkup.
Okay. Do you have any concerns that you want to talk about?
Nope.
Okay. Where have you gone before here?
Cottage.
Okay. And are you on any current medications?
I am on birth control, and I don't know what it's called, but I take it every day at the same time. And
Okay.
then Navcon A and Zaditor for when my eyes flare up. They're both eye drops.
Okay. And in the past couple weeks, have you been bothered by little interest or on doing anything?
No.
Okay. Feeling down or depressed?
Nope.
Okay. I'm just going to start off by asking you a few questions, and you can just answer yes or no, and then we'll go from there.
Okay.
Any unexplained weight loss or weight gain?
No.
Unexplained fatigue or weakness?
Nope.
Do you fall asleep during the day?
Yes.
When sitting?
Yes.
Okay. Are you getting enough sleep at night?
No.
Okay. Why is that?
Well, I'm in nursing school.
Oh,
And
well,
I have a 6-month-old.
Okay. That could explain a lot. How many hours of sleep do you say you get a night?
3.5 to 4.
Okay. Any fever or chills?
Nope.
Okay. Any changes in any moles that you have?
No. I have noticed though my mole up here on my right collarbone, it's gotten larger.
Okay. Any change in color or
Nope,
symmetry, anything like that?
Nope, it's dark brown.
Okay. Any rashes or itching?
Nope.
Any pain in your breast, any nipple discharge, anything like that?
Nope.
Okay. Any nosebleeds or trouble swallowing?
No.
Frequent sore throat or hoarseness?
I do have a frequent sore throat. I'm prone to having strep throat. Every winter I get it 3 to 4 times.
Okay. Have you had it this year?
I have. I've had it twice.
Okay. Any hearing loss or tinnitus ringing in your ears?
Nope.
Okay. I notice you have glasses. Are your prescriptions up to date?
They are.
Okay. Any changes in your vision? Any eye pain or anything like that?
Nope.
Okay. Any chest pain, palpitations in your heartbeat, anything like that?
Nope.
Okay. Any coughing or wheezing?
No.
Any snoring or altered breathing when you're sleeping?
I do snore, yes.
Okay. Are you short of breath? at
No.
all? Okay. Any heartburn, reflux, or indigestion?
Nope.
Any blood or change in your bowel movements?
Nope.
Any constipation?
No.
Okay. Any leaking or blood in your urine?
Nope.
Do you frequently go during the nighttime, like when you're asleep, do you wake up to go to the bathroom?
No.
Okay. Any discharge?
Nope.
Any concerns with your sexual function?
Nope.
Okay. Are you sexually active at all?
I am.
Okay. And do you use any contraceptives?
Yep. Birth control and condoms.
Okay. Any neck or back pain?
No.
Muscle or joint pain?
My left knee bothers me. I had surgery on it when I was a sophomore in high school, so when the weather changes, it gets very stiff.
Okay. Any sensitivity to heat or cold?
No.
Okay. Any swollen glands that you know of?
My lymph nodes in my neck,
Okay.
they're swollen.
I'll take a look at those when
Okay.
we start your assessment. Do you bruise easily?
No.
Okay. Any headaches, memory loss?
I get headaches if I don't wear my glasses, but that's pretty much it.
Okay. Any fainting, dizziness,
Nope.
numbness or tingling?
Nope.
Unsteady gait or frequent falls?
No.
Okay. Allergies to hay fever or anything like that?
Nope. I'm just like environmental. When it goes from hot to cold, that's when my allergies flare up the most.
Okay. Any frequent infections? I know you said strep throat, but is that all you've got?
Strep throat, and then I've had bronchitis twice and mono twice.
Okay. Any ear infections?
Yes, I just had an ear infection actually about a month and a half ago.
Okay. Any anxiety or stress? I know you said you were in the nursing program, so
yeah,
stress is a big one.
Stress for sure.
Sleep problem, we talked about your 3 to 4 hours. Lack of concentration?
No, not really.
Okay.
Sometimes.
Probably due to lack of sleep.
Yeah.
Premenstrual symptoms, bloating or cramping?
Yep, I bloat really bad and I cramp really bad.
Okay.
And that changed after I had my son. It wasn't like that before.
Okay. Any hot flashes or night sweats?
Yes, I sweat really bad when I sleep.
Okay. And are you all up to date on your immunizations?
I am.
Okay. Good. I know we talked about your birth control and your allergy medications. Are you on any other medications?
I'm not.
Okay. Any allergies or intolerances to medications?
Nope.
Okay.
Just environmental allergies.
Okay. Then I'm going to ask you a few more questions. Just answer yes or no, and we'll go from there. Alcohol or drug use?
No.
Allergy to hay fever, you said no. Anemia?
Nope.
Anxiety?
Yes.
Okay. And do you have any triggers for your anxiety?
Just when I have a lot to get done and I don't have enough time to do it. I get really anxious when it comes to that stuff when I have to meet deadlines.
Okay. Any arthritis?
No.
Asthma?
No.
Any bladder or kidney problems?
No.
Blood clots?
Nope.
Blood transfusions?
No.
We went over breast lumps, cancer in your breast or colon, or any other type of cancers?
Nope.
Okay. Any cataracts?
No.
Did you ever have chicken pox?
Yes, I did as a child. I was 5.
5. Okay. Any coronary artery disease?
No.
Depression?
No.
Diabetes?
No.
Diverticulitis?
No.
Emphysema?
No.
Any fractures or broken bones?
Yes, I broke my left arm when I was in 2nd grade.
Okay.
I broke actually my wrist and my arm at the same time.
Okay.
And I broke the bone beneath my kneecap, beneath my patella.
Okay.
I was in 8th grade when I did that.
Okay.
And those are all the bones I've broken.
Okay. Any
And my nose twice, I guess.
Okay. Any heartburn or GERD?
No.
Okay. And glaucoma?
Nope.
Heart attack, hepatitis?
No.
High blood pressure?
Nope.
High cholesterol?
Nope.
Irritable bowel syndrome?
Nope.
Kidney disease or failure?
Nope.
Kidney stones?
Nope.
Liver disease?
Nope.
Migraines? Headaches?
Only when I don't wear my glasses.
Okay. Osteoporosis?
Nope.
Pneumonia?
No.
Okay. Seizures?
Nope.
Any eczema, psoriasis, abnormal moles we talked about?
Yep.
Okay. Sleep apnea?
No.
Stomach ulcers?
No.
Any stroke?
Nope.
Thyroid? Nodules?
Nope.
High or low thyroid?
Nope.
Any other concerns that I should note?
Nope.
Okay, surgeries. Have you ever had any surgeries?
Yes, I tore my ACL and PCL when I was a sophomore in high school, so I had surgery on my left knee to fix my ACL. And I actually had a C-section with my son 6 months ago.
Okay, and was that your only pregnancy?
Yep.
Okay, so you just have one child.
Yes.
Okay. Knee surgery. Good. Any other surgeries?
No.
Okay. And then we're going to go over family history. So, anybody, parents and siblings are the most important to know.
Okay.
So just go ahead, yes or no,
Okay.
and let me know who has had any of these.
Okay.
Alcoholism or drug use?
My father.
Okay. Alzheimer's?
Nope.
Okay. Asthma?
My brother.
Okay. Autoimmune disease?
Nope.
Bleeding or clotting disorder?
Nope.
Breast cancer?
No.
Colon cancer?
No.
Any other type of cancer?
My grandfather had cancer. They classified it as unknown because it was everywhere.
Okay. Was that your mother's dad or your dad's dad?
My mother's dad.
Okay. Any other cancers in your family?
No.
Any depression, suicide, or anxiety?
My mom suffers from depression.
Okay. Any diabetes?
Nope.
Emphysema?
Nope.
Genetic disorders?
Not that I'm aware of.
Glaucoma?
My grandmother has glaucoma.
Mom's mom or dad's mom?
Mom's mom.
Okay. Heart disease?
No.
Hep B or C?
Nope.
Hypertension?
My dad.
Okay. High cholesterol?
My dad.
Hip fractures?
No.
Hypothyroidism or thyroid disease?
Nope.
Kidney disease or stones?
Nope.
Macular degeneration?
My mom's mom.
Okay. Migraine headaches?
My mom.
Okay. Osteoporosis?
Nope.
Any other tobacco use?
My younger brother and my dad.
Okay. And do you use any tobacco?
I do not.
Okay. Do you drink?
I do
At all?
not. No.
Okay. We already went over sexual activity. How would you rate your diet? Good, fair, or poor?
It's poor.
Poor. Would you like advice on your diet?
I would.
Okay, we can go over that a little later. I can give you some written things on that. Safety. Do you use a bike helmet?
I don't ride a bike.
No bike. Okay.
No bike.
Do you use seatbelts consistently?
I do.
Does your home have a working smoke detector?
It does.
Do you have any guns in your home?
I do. I have 7.
Are they locked up?
Yes, they are.
Okay. Is violence at home a concern for you?
No.
Okay. Have you completed an advanced directive for healthcare?
I have not.
A living will or
No.
physical orders? Okay.
No.
Is that something you want to do today?
That is something we can do later.
Okay. And then we're going to go over your social history. What's your occupation?
I'm a full-time nursing student, and my actual occupation is I work part-time at the Subway in Abingdon. I am the assistant manager.
Okay. How long have you worked there?
I've worked at a Subway since I was a freshman in high school, but I've worked at the one in Abingdon for 2.5 years.
Okay. And your marital status? Single,
I
married?
am single.
Okay. Do you have a boyfriend?
I do.
Okay, and what's his name?
His name is Jacob.
And you said you had one child, sorry, and 6 months?
Yes.
Okay. And no grandchildren?
No.
Who lives at home with you?
Both of my parents and my son.
Okay, no siblings or anything like that?
Nope, they're all out of the house. Just
Okay.
me.
Leisure activities, or group involvement, religion, volunteer work, anything like that?
I used to volunteer at my church. I don't do that anymore because I just don't have time.
Okay.
But my leisure activities are reading, not
Okay.
my textbooks,
Not your textbooks? Okay. Just your cell phone?
just my cell phone.
Okay. And then for your menstrual period, is that pretty regular?
Yes, it is.
Do you know of your last menstrual period?
November 23rd.
Okay. And do you know what age you were when you began your period?
I was 13, I believe.
And menopause does not apply to you.
I would hope not.
Okay. Well, we've got that completed, so now I'm going to go ahead and start your physical assessment. So we're going to go ahead and start and get your vitals. And I'm going to actually do your blood pressure in both arms to use as a comparison. And are you having any pain today at all?
I'm not.
On a 0 to 10, 0 being the lowest, what would you say your pain's at?
0.
Okay. Alright, I'm going to start by getting your baseline. So I'm just going to put this on. I'm going to take your pulse and I'm going to pump this up. And when I stop feeling your pulse, I will add 30 to that.
Okay.
Alright. Alright, looks like your baseline is 150. Alright. Alright, looks like 126 over 84, which is good. So I'm going to go over here. Alright. Alright, 124 over 82, so that's good. Okay. I'm going to go ahead and get your pulse now.
Awkward elevator music.
I'll put that in there. And I got 84 for your pulse, which is good. I also took your respirations and got 18. You want to do that when you're doing the pulse so they don't know when you're watching them breathe.
Okay.
But now I'm going to check and make sure that your pulses are equal on both sides. Which they are, and they're at a 3+, which is normal. And I'm going to go ahead and get your temperature here. Let's go ahead and open your mouth for me. Beep. Okay, looks like 98.4. That's good. Alright, and I'm going to go ahead and get your height and weight, so if you'll stand up for me. We don't have a tape measure. Okay, looks about 5'4". Go ahead and step on the scale for me. Okay, 130. Does that sound about right?
That's perfect.
Okay, great. Go ahead and have a seat. Okay, I'm going to go ahead and inspect your skin. Just going to look for any breakdowns, check the color, make sure it's tan and pink, and make sure your skin blanches, which is good. I'm going to check your turgor. Should bounce back. Check for dehydration. Your cap refill should be less than 2 seconds. Check for circulation, which is good. No rashes or bruises, you said?
Nope.
Okay. No masses or lumps.
No.
Do you have any piercings or tattoos?
I do not have any tattoos, and I do not have any piercings, just my ears.
Just your ears?
Mm-hmm.
Okay. Turgor was good. Okay. And then you had no edema on your hands or wrists or anything like that, so that's good. I'm going to go ahead and inspect your head and neck now. I'm just going to check your hair for any pests or living organisms. And check your head for any masses or tenderness. Any tenderness as I'm palpating here?
No.
Okay. That's good. I'm going to check your lymph nodes here. Can you go ahead and swallow for me? Okay. Can you open your mouth? Okay. One more time. Good. You shouldn't hear any pops or anything like that. I'm going to go ahead and take your glasses off for me. I'm going to check your temporal arteries. Okay. And that's good. We're going to do a little test here, testing with a dull and sharp.
Okay.
So I'm just going to use this here.
Okay.
So go ahead and close your eyes for me and tell me if this is dull or sharp, okay?
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Oh, you are a nasty word, and if we weren't recording, I would call you a...
Okay. Was that sharp or dull?
That was inappropriate.
Okay, we're gonna...
You are fired.
Alright.
I'm going to your supervisor.
Go ahead and move your neck back and forth for me.
Oh, just pops.
Look up. And down. Alright, good. We did the swallow test. I'm going to check your pulse here. See if we can palpate that. That's good. Alright. Okay, go ahead and raise your eyebrows for me. Wrinkle your forehead. Okay. We're going to actually check for perla.
Okay.
Pupils are equal, round, reactive to light, and accommodation.
Okay.
So go ahead and take your glasses off for me. Alrighty. So that's good, and we're going to turn that back on. And I'm going to have you look across the room here and focus on an object for me. Okay? Good. Now continue to look at that object. And then go ahead and look at my light. Good. Okay, and I'm going to have you read this eye chart here. So go ahead and stand up. Go ahead and cover your right eye for me. And just go ahead and start from the top and read as far down as you can go.
E, A, B, C, D, E, F, G, H, I, J, K, L, M. That's it.
Okay, go ahead and switch. And do the same thing for me.
A, B, C, D, E, F. That's all.
Okay. Go ahead and have a seat. I'm going to use this ophthalmoscope here and look at your eyes. Okay. So go ahead and remove your glasses. Okay, I'm going to turn this on.
You're looking through a wrench.
Okay. I'm so scared. Checking your retinas.
Okay.
Okay. Alright, now we're going to go and check your nose here. So I'm going to have you occlude one nostril and sniff for me. And the other.
I'm a little stuffy.
You need to blow your nose
I do.
more often
I
than you
do.
do. Alright, and it looks like your nose is symmetrical, and I can tell that you've broken it multiple times.
Mm-hmm.
Okay.
Shut up.
And we're going to do the smell test, so I'm going to grab a dirty diaper over here. Now I'm going to have you close your eyes and go ahead and smell this for me and tell me what you smell.
Coffee.
Okay. Grab something else. Go ahead and smell.
Pizza.
Okay, good. Alright. Alright, we're going to move on to your ears here.
Okay.
And it looks like your ears are, your pinna is attached. Your earlobes are attached. Alright, I'm going to have you stand up for me, and we're going to do this whisper test.
Okay.
I'm going to stand in 3 different positions, and I'm going to whisper a word to you, and I want you to repeat it back to me. Go ahead and massage your tragus while we're doing this, okay? We'll start over here. Yes. Stacy.
Stacy.
Give me
Give me
an
an A.
A. Okay. We're going to go over here. Stacy.
Stacy is
My
my favorite.
favorite. Okay, good. Go ahead and have a seat. Alright, now I'm going to get to my ophthalmoscope here, which is my handy dandy drill. And I'm going to look in your ears, okay?
Okay.
So just,
Don't get into my cranial cavity.
okay.
Dude, that tickles. Don't do that. Come on, be serious.
Okay, good. That seemed to check out okay.
Wonderful.
And I'm going to
That's
go
great.
ahead and use my tuning fork. I'm going to hit it off my hand and put it next to your ear, and you'll feel a vibration.
Okay.
And then I'm going to see if you can hear it. You're going to want to hear it longer than you can feel the vibration.
Okay.
Okay? You ready?
Yep.
Do you feel it vibrate?
I do.
Can you hear it?
I can.
Okay. Can you feel it vibrate?
Yep.
Can you hear it?
Yes.
Good. Alright. Alright, now I'm just going to take a look at your lips and your mouth here. Go ahead and smile for me. Good. Looks symmetrical. Nice and beautiful smile.
Of course, I have braces.
Okay.
Okay.
Go ahead and open your mouth. I'm just going to inspect and look at,
Ah.
check for any lesions. And you got pink in there. That's good. No lesions on your tongue. Your gums were nice and pink. We did your jaws. Jaw strength was good. Moisture was good. And you did your smile, which was good. Now we're going to look at your extremities here. And we did palpate your extremities and your arms. No tenderness or anything there.
Nope.
Okay. And did your pulses. Now I'm going to have you put your arm like this. And I'm going to check your reflexes up here, okay? With my hammer. Alright. Ready? Good. We're just going to do your brachial here. Okay. Alright. Good. Okay. And your fingers and hands. Let's look at those. Any pain or tenderness here?
Nope.
Okay. Can you go ahead and make a fist for me? Open them back up. And touch your fingers to your thumb. Opposition. Good. Alright. Oops, sorry. Alright, I'm going to go ahead and listen to your breath sounds now.
Okay.
Your lungs, and we're going to... That works. Alright, just go ahead and take a deep breath for me when you feel my stethoscope on you, okay?
Okay.
Okay. And any trouble with that?
Nope.
Any trouble with your deep breaths, anything like that? Alright, go ahead and take a deep breath for me. One more time. Okay, good. Okay, you can go ahead and turn back around. Alright, if you want to actually lay down for me, I'm going to auscultate your bowel sounds, and I'll listen to your heart while you're laying down.
Okay. Okay. I think so. Yeah, you can. You can see it. Okay.
Go ahead and listen to your heart, okay? I'm going to go ahead and listen to your apical pulse.
Okay.
So that'll be a full minute, okay?
Okay.
Okay. You got 82, which is good.
Okay.
Alright. You can go ahead and sit back up for me. Every month do you perform breast exams on yourself?
I do every third of the month.
Okay, and is do you do it
In the shower.
Okay, good. Alright, now I'm just going to go ahead and inspect and palpate your legs.
Okay.
So let me know if you feel any tenderness or anything down there. Any bruising or anything down here?
No.
You got a little bit of dryness down here.
Yes, I'm very itchy down there right now.
Okay, it's probably because it's coming on winter. Well, it is winter, so just go ahead and put some lotion and it'll help with some dry skin. Even hair distribution. No edema, anything like that.
No.
Good. We're going to, again, do the light and dull test again.
Okay.
Alright, so let me know if you feel sharp or dull. So
Okay.
go ahead and close your eyes for me.
Sharp. Dull. Sharp. Dull. Sharp.
Good. Alright, and now I'm going to test your reflexes on your leg, okay?
Okay.
Down here.
Oh my God.
Okay. Good. I am going to check your pulses on your feet as
Okay.
well. Oh, I'm sorry. Okay. Sorry about the laughter next door. Our clinic is not very sympathetic. Alright, go ahead and stand up for me. We're just gonna, I'm gonna observe the way you walk and just walk normal for me.
Okay.
Go ahead and stand over there. Sorry. This clinic is a mess. Okay, good. Go ahead and walk on your on your toes for me. Okay. And on your heels. And go ahead and walk in a straight line for me. And that's good.
Okay.
Go ahead and stand here. I'm going to have you put your arms out and touch your finger to your nose. And both. Good. Okay. Go ahead and we're going to do range of motion on your legs.
Okay.
So just go ahead and bend your leg for me. And that works too. And stick your leg out. Back. Front. Good. And the other leg. Yes, that works. to hit your ankle on the bed. Okay, good. And did you go forward and then circle? Okay, great. And go ahead and do your heel to your opposite shin. Do you want me to take a look at that ankle for
I
you?
think I need some ice. Some cold therapy.
Okay. Alright, go ahead and have a seat.
Thank you. That's wonderful.
You're going to take a look at that
I
ankle.
do.
Looks like a person is already in place. Okay. Alright. That completes your full head-to-toe assessment. Do you have any other questions?
I do not thank you. You were very thorough.
Okay, thank you. Have a good day.
You too.